Hi, I'm Dr. Brent with the Family Chiropractic Centre in Guelph, and one of the most common questions that I get from patients is when should I ice and when should I heat? So I'm going to make it real simple for you today and give you some pointers on when you should ice, when you should heat, how it helps, how to decide between the two, what to use, how long to do it for, and just keep it real simple. So to begin with, if an area is tender, if it's swollen, or if you have radiating pain, you only want to ice. And you shouldn't be stretching, that's the other thing too. Think about this, why would you put heat, for example, on like a sprained ankle or a sunburn? You wouldn't. And you wouldn't want to stretch a torn muscle either. So that's where you only want to ice. So if it's tender, or if there's radiating pain, numbness down your arms or down your legs, or if there's swelling, or if it even looks red, you don't want to put any heat. So just ice, because there's already enough heat there. So how does ice help? Ice creates local pain relief, which means you probably have to take less medication. Doesn't mean that you can't take medication, but obviously icing to minimize the medication would be good. It numbs the area, that's how it works. It also decreases blood flow to the area, so it decreases swelling and then secondary pain that you might have from the swelling in the damaged tissue. So that's how the ice will help. How long should you put the ice on for? If it's something superficial like an ankle or a wrist or an elbow or a knee where the tissues doesn't have a lot of padding over top, not a lot of muscles, then 10 minutes is probably fine. 10 minutes at a time. If it's something, deeper tissue, thicker tissue like your lower back or the buttock area, or maybe even the front of the thigh, then you're going to want to put it on for maybe closer to 15 or 20 minutes. How often should you do it? 3 to 5 times a day is what I usually recommend. That's pretty good. If you really want to go more intense, you can do it every couple hours. I wouldn't do it more than that, but every 2 hours. So as soon as you start icing, put your timer on for 2 hours, that way you don't forget. And then 2 hours from then, you'll be able to put on the next application. Can ice make it worse? Well, you can freeze the skin, that's for sure. So whatever you're using, you want to wrap it up and make sure that you're not freezing the skin. The other thing is that if you ice for longer than about 30 minutes, your body experiences what's called the hunting reaction, where you've actually cooled the area so much for so long, your body starts opening up the blood vessels and putting more heat into the area, and it almost has a heating effect. So yeah, I never want a patient to ice longer than about 20 minutes. That's about the safest. And that would just still be for the lower back area or buttock area, some thicker tissue. People often ask, they say, or their comment is, I'm just way too busy. How am I gonna ice? Well, so I'm all about multitasking. So if you're already sitting, usually it would be an area that you could sit and ice at the same time, whether it's around your neck or your lower back. Then think of the times that you're sitting. So driving to work is an easy one, unless the car is freezing cold first thing in the morning. But and then the seat heater for thawing the ice pack is probably not a great thing. But ideally, when you're driving to work and you're driving home, that's twice a day. And even if it's like a 20-minute drive, there you go, you got your 20 minutes right there. If it's an hour drive, obviously you're not going to ice for an hour long, but you're sitting anyway. So take an ice pack with you, stick it behind your back, stick it on your shoulder, whatever you're doing. And then you can ice on the way to work and home. That's twice a day right there. If you're sitting at work, obviously doing it there would be great. If you have a freezer at work, bring a couple packs so you can rotate and keep something cold. During your meals, breakfast, lunch, dinner, there you go. If you 3 times a day, so between the 3 times a day for eating, when you're sitting ideally, and then twice a day to and from work, that's already 5 times a day. So shouldn't be any excuse not to ice. What do I use to ice? Is a common question. You don't want to use like cubes of ice because they're going to melt and they're going to get too cold and they're going to get too wet and it gets way too messy. So yes, you can use it if you have nothing else, but it's lumpy and it doesn't really work well. So you want to use like a soft gel pack. And the size should depend on what you're icing, right? So if you're icing something like your shoulder or your neck or your elbow, a small pack is all you need. We have these ones in our clinic that are kind of like a necklace. You can throw it around there. It's great for that lower part of your neck. Something bigger would be required for your lower back, for example, or your mid back, and you can just stick that behind you. Make sure when you buy these, if you don't have them, that you get a couple, because you want to. They take a while to freeze, so you get a couple that you can keep rotating. A bag of corn, bag of peas works too, but if you keep freezing, thawing, you're not going to want to eat it. So if you want to use that, take a big magic marker, put a black X on it so someone doesn't eat it and wonder why it's all mushy. And then you're going to want to make sure you wrap that in something so you don't freeze your skin. Okay, and when that comes, and you don't want to use like a bean bag, because those little bean bags that you put in the microwave are better for heating. They don't really get cold enough for icing an area. And when you're done, people often ask me about deep cold or biofreeze. You can rub that into the area. It will be relatively superficial. It won't be as good as icing, but maybe it's a nice way to finish. So as far as icing, that's what you do. So if it's tender, if it's swollen, tender to touch, icing only, no heat. Now if you have an area that's tight but not tender, and there's no shooting pain in your arm or your legs, then you start looking at heat. The idea with heat is that you're better off with wet heat than dry heat, like an electric heating pad. It's going to be pretty superficial. Something like a hot shower, a hot bath is going to penetrate deeper into the tissue, so that's ideal. If you have tenderness only when you touch an area, you're kind of in the middle of the healing process, so it's tender, so you'd want to ice, but it's only tender when you touch, so you can alternate ice and heat. You probably had the injury for a while now, your tissues are starting to recover, so you don't have tenderness without even touching, so you can alternate ice and heat, that's fine. If it's not tender at all, even when you touch it, it's just tight. If it's tight, non-tender, then you'd only use heat. There's really no benefit at that point for icing. And now you can start stretching. If you have tissues that are not tender to touch, then you can go ahead and stretching. And remember, for another video I explained how stretching, the length of time depends on your age. So if you're under 20, you want to hold a stretch to get a lasting benefit for a minute. If you're 20 to 40, you want to hold for 2 minutes. If you're over 40, you want to hold for 3 minutes. As far as what to use for heating, yeah, you can use the bean bags. You can use a hot water bottle. Like I said, a hot bath or hot shower is good. Often Epsom salts, the magnesium in the Epsom salts helps relax muscles as well, so that's good. And then if you have some Glenalgesic, some Rub 8535 Tiger Balm, you can rub that in. So that just kind of hopefully makes it pretty simple as far as when you'd ice and when you'd heat. Hope that helps. Subscribe if you haven't yet. Leave any comments, suggestions in the comment section about other videos that you like, and I'd be happy to make them for you. I'm Dr. Brent. Make it a great day.